to all the people who put today together. It's been a great day for me just to sort of sit back and get all this attention, which is awesome because I feel like you're talking about me. So let me start by saying this. I'm fully cognizant of the fact that the weekend is somewhere looming out there. You folks are stuck in here. The only thing that separates the two of you is me in this presentation. So I will be as concise as possible, but the good news is I've got about 5 or 6 slides. And there's no p-value. There's no regression analysis. There's no confidence interval. It's just a bunch of pictures. So if you just hang in here a little bit longer, we'll get there, okay? I'm not a big fan of standing behind a podium because that is a presentation. I want this to be a conversation, right? We'll kind of start with that as the backdrop. So my daughter, who happens to be case number 1, in case you were wondering, is behind me. She saw the agenda for today's presentation probably 2 or 3 days ago. And I saw her looking at it, and she was giggling. And I said, "What's so funny?" And she said, "You." I said, "What do you mean, me?" She goes, "Well, you're the only guy on the agenda without initials after his last name." I said, "What do you mean by initials?" She goes, "Look, MD, 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 PhD, RN, et cetera, et cetera." And I reminded her that being without initials does not mean I'm without credentials. So here are my credentials. Prolonged QT type 1 diagnosed 2 years ago-ish. I have 3 beautiful children. The youngest 2, aged now 11 and 9, are prolonged QT type 1 positive as well. I have a good fortune of being married to a beautiful young lady who is not here today. But she's blessed with the peace and tranquility of living with 3 of us at risk for sudden cardiac arrest. I have an 11-year-old daughter. This is probably her at 8, but she is the survivor of cardiac arrest. And last but not least, I am the witness to said cardiac arrest. So as I informed her, I have a PhD in life, all right? So we'll kind of start there as the backdrop. So let's get into my story. So my wife and I met in 1993-ish. She was roommates with my ex-girlfriend, which sounds incredibly scandalous, but is not. We married in, that was 93. We married in 1996. We were married for 4 years before we started having children. And quickly, we caught up. We have 3 kids, and at the time, the oldest was about 10, life got really chaotic. And I know those of you in the room know how this story goes. You start them out in youth soccer, and before you know it, they're all trained to be professional athletes, because you can't play soccer in the fall and be done with it, right? You have to play soccer in the fall, indoor soccer in the winter, spring travel, and you do it again and again. Such was our life. Our sport was hockey for the boys. We played hockey in the winter, 3-on-3 in the spring, and we did camps all summer. My daughter was a swimmer, et cetera, et cetera. I think at its worst point, my oldest son was in 3 sports. My other 2 were in 2, that's 7. That was in 1 season, but it's maddening, isn't it? And we said the same thing over and over. We're going to stop this next season. We said that season after season. And every Sunday night, we would literally fall into bed and say, we're going to simplify, right? But we never simplified until September of 2011. And things got real quiet real quick, but not in the way we probably would have anticipated. So it was a Friday, and I took my daughter, who had demonstrated a little bit of ability to be a swimmer, to her first indoor swim team practice, right? Swim in the summer is not enough. You're kind of good, you got to do this indoor stuff. So I dropped her off and got her registered at 7 o'clock. My youngest son and I ran across the street to get dinner. I convinced him that the nuggets were a healthier option than the Junior Baconator with cheese. We had dinner, we ran back across just in time to watch Claire swim for about 20 minutes or so. At about 5 minutes till almost the end of practice, she stopped swimming. I don't mean she was tired. I don't mean she had a cramp. She stopped swimming halfway across the pool. And I sort of saw the commotion, but couldn't be Claire. Claire's a great swimmer, good athlete, right? Somebody must have hit their head. And I sort of looked over, and they were pulling her out of the water. And it was Claire. And they started compressions. Not the compressions that you learn about in CPR training where you sort of half pay attention. I mean like actual compressions on a real person, 15 and 2. So I sort of hobbled over. I just had my ACL repaired. And I walked, and I got about this close, and I couldn't get any closer. It was like a force field, right? There was a third lifeguard standing at Claire's feet, and one of the parents in the room had the foresight to drop the defibrillator. And we talked about this before. You know the defibrillators, the AEDs that are really easy to use, that are simple and everyone can use them? I don't remember a lot about the night, not in clarity, but as I looked at the lifeguard, I said to her, you need a shocker. You need the shocker. I work in and out of the cath lab, so I've seen countless people be defibrillated. I said, you need a shocker now. The first thing I really, really genuinely remember is that young lady looked up at me, She had tears down her eyes, just tears pouring down her face. And she mouthed the words, "I'm sorry. It's my first time, I'm sorry." She froze. Not a criticism, an observation, because guess who else froze? If you'd asked me 2 weeks prior, could I use an AED on someone? They're easy, right? She froze. Then came the truly hard part, right? As we waited for the squad to arrive with the defibrillator that someone could actually use, I had to call mom, right? Nothing's real until mom knows, right? You guys know how that is. I called my wife, Christy, on the phone. She didn't answer. She had my oldest son at a high school football game, so I figured it'd be tougher to reach her. I called her twice. She picked up the phone. She didn't say hello. She didn't say what's up. You moms know what she said. She said, "What's wrong?" The second thing I verbally remember is that scream, right? That's hard. You guys, moms know something's going to happen, and they always worry about it. In this case, it did. So Claire was taken to Riverside, intubated, then taken to Children's Hospital. She spent 3 weeks there, right? Hard 3 weeks. Got her ICD a week after, roughly a week after. And about 2 weeks into her stay, we had already signed up for a heart walk. One of our very dear friends of our family, their son has a structural heart issue. So that's quickly morphed in from Charlie's heart walk to Claire and Charlie's heart walk. And the hospital, Naomi, said, "Yes, you can go on one condition. She does the heart walk in a wheelchair." She was a little wobbly. This is my favorite picture in the entire world. We got about a quarter mile into the mile walk, and Claire said, "I'm done with the wheelchair." And she got up, and that's my wife sitting there. It's probably the first time that lady had breathed in about 2.5 weeks. And you can see it almost like a catharsis, right? Favorite picture in the world, it's actually on my nightstand. So the number one question I get today, and the obvious one, is how is Claire doing, right? Most people who ask the question are just like you or just like me. They're busy. They want the hallmark answer. The hallmark answer is she's doing great. But you guys are in the healthcare field in some way, shape, or form, and you know it's not often that simple. It's a bit more complex than that, right? So because you paid the full price of admission, I'm going to give you the full story. I've tried to encapsulate how she's doing in 4 quick pictures, 4 quick slides. You with me? Story number 1, 2 weeks into our stay at Nationwide, this lady pulled my wife and I out of the room. She said, "I need to talk to you." I said, "What's up?" She goes, "Let's talk about being a parent." If you remember this or not. She said, being a parent with a sick kid is funny because you want to stop being a parent and start being a friend. You want to say yes to everything and no to nothing. If you do that, if you can do that, you're going to create a monster. You're going to create an absolute monster. And she continued. "So, does Claire own a horse?" I said, "A what?" She said, "A horse." I said, "No, she doesn't own a horse." She said, "Then don't go buy her a horse." Point taken. So, I may get off on a technicality, but I'm going to use it nevertheless. We do not own a horse. We lease half of that white animal on the right side, all right? So let me explain. This didn't happen overnight. We sort of morphed into this over the next year. Claire was unable to continue her swimming career, obviously, or her soccer career. So I said, "What do you want to do?" She wanted to ride a horse. So let's go ride a horse. And we sort of tiptoed into this world, and now we're in it head first. But here's the deal. When you ask me how Claire's doing, I watch this young lady on the back of a horse, 800, 900-pound animal, I don't know what they weigh, and she's trying to keep her heels down, her leads correct, her back straight, and she's negotiating this animal between and over and around things. And the thought occurs to me when I watch her, she's not thinking about the past. She's not thinking about the future, she's in the now. And I know that money I'm spending on that dumb animal on the right is well worth that hour to 2 hours a day where she's in the moment. Claire's doing great. Story number 2. This is Miss Jenna. In a weird sort of twist of fate, Miss Jenna is the niece of one of my very dear friends from high school. Miss Jenna had a similar event happen to her when she was, I believe, a junior. She is a great runner. She collapsed during a race. Jenna sort of became our beacon of our family. She got an ICD, and we'd all often mention to Claire, Jenna, look how great she's doing, how strong she's doing. We sort of lost track with Jenna the last few years. A month and a half ago, Miss Jenna had a track meet, college track meet, partial scholarship in Indianapolis, Indiana. And she was 300 yards from the finish line, and she collapsed. And she never recovered. She died a couple of days later. Story number 3. This is Will. He's the lucky one of the house. He's not affected by prolonged QT type 1. Will is 13 now, and he quickly got the family memo that golf was our new favorite pastime in our household. And although he wasn't effective with prolonged QT, he embraced it headlong. He's been playing hard, like really hard, and practicing for about a year and a half. Will made the 8th grade golf team this year. He broke 80 for the first time. He got a hole-in-one and an eagle this year, none of which are important. That's just a dad bragging. What is important is he's become a leader in our household. He has, for my younger son, who we're pushing towards golf, he's become a leader, and he's made golf cool, right? And speaking of the younger son, this is Reed. Reed is age 9. He's a sweetheart of a kid. Reed approached me about 3 weeks ago. I was grilling out on the back patio, and he said, I have a question. I switched question. He goes, a couple of my buddies are forming an indoor lacrosse team this winter. I want to know if I can play. And I said yes. I said yes. What's the worst that could happen, right? But I know all too soon the answer is going to be no, right? As the competition gets more intense, as the conditioning becomes more intense, these are just kids running around. But the answer is going to be no, and that breaks my heart. Do you get the theme that I'm trying to convey? This job and this business that we're in as a family is not all doom and gloom, but sometimes it is. It's not all a bed of roses. Sometimes it is. It's a series of highs and lows, of ups and downs, right? This is the crew. Some of you have seen this picture, maybe on the invitation to today. Love the picture, not enamored with the caption. The caption, if you can't read, is the Burkholz family thriving with long QT. What it should say is the Burkholz family choosing to thrive with prolonged QT, right? Because I'm honest with you, there are days when it's quiet in our house, when aren't many with 3 kids, but there are quiet times when I let my mind race. And I think about what could have been, right? Or what may be tomorrow. And I want to stay in bed, but we choose to get up and take that step. Our passion, how we define thriving, is the following. We choose to educate ourselves and in turn educate others, right? We choose to embrace this heart-safe school accreditation, so it's so critically important. And more than anything, we make the choice to live our life to honor the gifts that we've been given. Claire's alive, great, and we have knowledge and we have power to potentially prevent this from happening again. To be sure, thriving for us looks different than it does for most of you and your families. It looks different from us than it used to look. Thriving for us is no longer about goals scored, trophies won, rebounds, interceptions. It's about living life. It's about making memories. It's about laughter, right? And I think on that scorecard, we're doing pretty well. So I'll close with this. This isn't the first young lady who's had a cardiac arrest, right? And if we can agree on that, we'll also agree on the second statement. She's not the last lady, right? Some kid swimming in your community, your mind, at some point in the near future is going to stop swimming halfway across the pool, right? Or some kid playing soccer is going to stop running, or some 40-year-old male is going to be on the treadmill in the gym and he's going to collapse. We choose to tell our story because we want to do everything in our power to make sure that family has the ending that we had, right? By virtue of your attendance today, you guys are part of our story now. The only thing I would ask is go out and educate, go out and advocate and be passionate about it. Thank you for your time. God bless.